Greetings. This is going to be a little long video because I want to talk about transplant, especially kidney transplant in Nigeria. I want to talk about kidney transplant in Nigeria. And what is transplant? Transplant is, I will explain it in a very easy way. The replacement of a failing organ with a functional organ. An organ that is failing or has failed is replaced with an organ that is still working. In Nigeria, we do some sort or a lot of transplant surgery now, especially liver transplant, kidney transplant, even transplant of the skin, hair transplants. They do it in Nigeria now. But the commonest transplant we do, and we have been very proficient at, and we are very good at, is kidney transplant. Now, in kidney transplant, I'm going to tell you about the cost of kidney transplant in Nigeria, where you can get kidney transplant done, the problems, complications associated with kidney transplant, and what you should do after you have had your kidney transplant, and how long a transplanted kidney is supposed to work. Kidney transplant is done for people that their kidney has failed, or has failed, yes, or has failed, or is failing. But most times it's done for people that their kidneys have failed, meaning their kidney is no longer carrying out its statutory function. So the kidney has failed. The kidney can no longer filter waste from the body, can no longer filter water, excess water from the body, can no longer produce vitamin D, can no longer produce erythropoietin, that is the hormone that is used in blood production. Can no longer, so the patient is weak, bloated, that is the whole body is bloated, swollen up, right? Passing very small volume urine or not passing urine at all. So when you see such category of people, and this person have been, and the patient can only filter waste from the body with dialysis, and with time, they will be advised to go for a transplant. Now, how do you get donor? How do they get donor in Nigeria? Well, donors can either be your relative, right, which is known as allogenic, right? Can It's either from your brother, your sister, your mother, your father, or it can be from a dead person. But in Nigeria right now, the donors we use are from living persons, and most time are our relatives. Right? That is how far we have gone so far. But we have not been able to do the one where the kidney is coming from a dead person. They call that one cadaveric donor. Now that's that. And there is a age range with which you can donate. Normally they say it's from 18 years to 60 years. That is the age range with which you can donate kidney in Nigeria. Don't forget, every country have their laws. In other countries, it may be different years, but every country have their laws based on how they deem it fit. But for Nigeria, it is between 18 years to 60 years. Some say 65 years. Different opinion, but according to law, between 15 years to 60 years. Mostly from our relatives. Mother, father, uncle, whoever. It can also be from distant relative. It can also be anonymous donor, right? It can be an anonymous donor, but just know that it is a living being that is donating it. That's that on how kidney is donated. The person that will donate the kidney, I need to talk about that person, will be checked, right? They will screen the person for HIV, hepatitis B and C, tuberculosis, diabetes, hypertension. They will screen the person for all these diseases, right? Then they will screen the person for all those, let's say, some autoimmune diseases like systemic lupus erythematosus, rheumatoid arthritis. They will screen this person for all these diseases to be sure that the person does not have any of this. Now, they will also check the blood person's blood group. Blood group, they call it ABO compatibility. They will check it. When they've done that, then they will also check how many kidneys the patient have, the person that is donating have. How many kidneys does the person that is donating the kidneys have? Because you don't, that means the person will do a scan. You're not going to remove kidney for somebody that have one kidney. You have damaged the person. So the doctrine is the person that is donating kidney should not die in a bid to try to help another person. So you will check how many kidney because some people have one kidney. So you do scan to be sure that the person have two kidneys. Now, after that, after the person have been screened, the patient will be the person, the donor. Sorry, I use the patient because I'm a doctor. The donor will be counseled, right? Will be counseled, sign some legal document because it's a legal thing. Sign some legal document. The patient, the donor will also give consent, like permission. I give you permission to take my kidney for Mr. A or for Mr. Kule, for Mr. Ebube or Mrs. Ebube, right? I give you permission to take my kidney to help this person. So the patient, the kidney will now be harvested, right? But before we go there, the person that the recipient, which is the person that have the kidney disease now, the kidney failure, right? The person that have the kidney failure will also be checked. The person will be screened, right? The person will be screened. They will do HBO typing. There's what they call HLA typing. These things are very expensive. Oh. They are expensive. This test alone, especially that HLA, is about ₦1 million. So HLA typing, HBO typing, they will do all those. Then make sure that the patient, the person, the recipient is fit for surgery. Sometimes they may do the surgery at a go. Sometimes they will do the surgery. Maybe they will take the kidney from the donor first, then the following day. But most time it's on the table. They do the two at the same time, right? So the kidney, and also one thing I will tell you is that the best of the kidney, they will also screen the donor and make sure that the best of the kidney is what they leave behind for the donor, right? The best, you know what I mean by the best of the kidney, best of the best. They will leave it behind for the donor. They will take the other one. The other one is also the best. It's just how they say it. They'll take the kidney from the donor, operate. They will it's an operation. They open on the donor, take the kidney, then transfer it and give it to the recipient. And after a recipient has been given this uh, kidney on table, then they will start monitoring the recipient. There's a major problem with transplants generally. There's a major problem, and I need to mention it. Irrespective of the technology you use, the typing, the screening you did to make sure that there's no rejection, there may be rejection. There can be on-table rejection as you just transfer the kidney and give it to the recipient. The body will just reject it. Rejection means the body of the recipient. Like if I have some issues with my kidney now, they give me a fresh kidney. My body can reject it. Even though I've been screened, they've done all sort of tests to make sure that everything goes well. My body can just decide to reject it. The immune system in my body can decide to reject it. You can see how dicey the thing can be. So to make sure this does not happen, and this rejection can be on table, that is in theater, as they just transfer the kidney, the body will just reject it, the kidney will just turn black. It can be the next day. Then it can be in 3 months. It can be in 6 months. It can be in a year. So when it happens on table, that is why the patient is still the patient is still in theater. It's called hyperacute rejection. Then if it's within 6 months, it's called acute rejection. Then if it's greater than 6 months, it's called chronic rejection. Rejection means that the kidney that they transplanted to the recipient is not able to carry out the function that it was actually meant to do. That is, the kidney is now useless to the person they gave it to because the body have rejected it. That's what rejection means. It's not one very big English. That's what it means. They gave me the kidney, my body rejected it. And my body rejected it. They gave me the kidney. Instead of me to now be able to perform my function, the kidney to start carrying out its function of filtering my blood system and making sure I'm okay, the problem remains because the kidney they gave me is not working because my body have rejected it. That is rejection. Inability of the transplanted organ to carry out its function. The body has rejected it. So that's that. Now, after that, what now happens? To make sure this does not happen, the patient is given what they call immunosuppressants. There are different types, but I don't want to mention any name here. Right? There are different types of immunosuppressants, and these immunosuppressant drugs are very expensive. For example, tacrolimus is super expensive. Steroids and all sorts. Islatopre and the rest. They are all those big names. They are some of the immunosuppressants they use. They are very expensive. Then some antibiotics will also be given to you so that infection will not enter the transplanted kidney. That's that. So the major complication of transplant is rejection, and it's a global phenomenon. I was in a webinar recently where the American surgeon, kidney surgeon, was saying that in the United States that they operated on they transplanted a kidney for a patient that while they were just still trying to stitch the transplanted kidney together and make the kidney just turn black. Said he have never felt so bad in his life before. I mean, in the US, like because it took them time to source that kidney. The kidney just went black. The body rejected it on table, just like that. But it's all these things does not mean should not discourage you. These are some of the complications which can be avoided. Can be avoided. Uh-huh. Many of the kidney transplants that have been done were not rejected. Now, I've talked about the complication. Then the patient, because the patient is also taking immunosuppressant, that is, the immune system is suppressed so that it will not reject the kidney. The patient is prone to infection. That's why you see some people with kidney transplant that have had kidney transplant. They are always wearing face masks. They are always living in clean environment. They don't want to have any contact with anything that will make them come down with infection. Now, where can you do kidney transplants in Nigeria? See, there are many centers in Nigeria that do kidney transplants. Private centers and Nicholas, they are good. Zenith Hospital in Lagos, they are also good. Cedar Crest, good. They are private. Like, see, I don't want to mention names, but many. But I can mention government names. You see, Aminu Kano Teaching Hospital. In fact, they do kidney transplant these days as a routine. It's now like something they do in, week out. In fact, as we speak, Aminu Kano Teaching Hospital in Kano, that is in Kano State, have done over 100 kidney transplants since inception. Over 100 and successful kidney transplant. So they are doing well. So they do kidney transplants in Nigeria. It's just you that don't know. They do it successfully, and everybody, the person is fine and the rest. Then, one thing I will tell you about kidney transplant is that a transplanted kidney can survive for between 9 to 13 years. If you have been transplanted the kidney can survive for between 9 to 13 years. It does not mean the person will survive for it does not mean that's the lifespan of the person, no. It means the kidney that was transplanted can survive from between 9 to 13 years. After which the person can decide to get another donor and still continue living his or her life. You get. That is that. Then what's the cost of kidney transplant in Nigeria? Well, the cost of kidney transplant in Nigeria, it depends on when you are doing it. Oh. Like in Aminu Kano now, if you want to do kidney transplant, you spend close to 5 to 10 million, right? You spend close to 5. Okay, let's say 4, 6, 7, 8, 9, 10 million. You spend that because even the drugs Immunosuppressants are expensive. I'm considering all those things, your hospital stay, logistics, the surgery itself, getting a donor, all those things, right? In the big centers, St. Nicholas and the rest, you spend quite an amount, or you spend a huge amount of millions, if you understand what I mean. So that's all I can tell you about kidney transplants in Nigeria. Before I go, please, if you are battling with kidney diseases and you are planning to do transplant, just you can do it in Nigeria. And don't give up hope. Don't give up hope. Your life is not going to end because you had a transplant. You are going to live your life. See, I've met people that have had transplants before and they are doing well, right? They just take their drugs, their immunosuppressant, that they are doing well. So it's not the end of life. The only problem you have now is how to get the money. But kidney transplant is more expensive, is less expensive than dialysis because in the long run, you are going to be doing dialysis twice a week. And a session of dialysis is about 50 to 60,000. Imagine you do that for 10 years. It's not that you will get back to your full function, no, because you will still be weak, not able to help yourself. But when you do kidney transplant, within 3 weeks, 6 weeks, you are okay. So think about this. This video is meant to educate Nigerians and Africans, but Nigerians especially, so that we get to know all these things and how to go about it. Please, if I really educated you, you enjoyed this video, like and follow me, please, and share this video for it to reach. Please, it's time for me to reach 1 million views, and this video may just be it. Thank you and bye bye.